Hi guys, so what we're going to do here is we're just going to go through all of the points of the ankle because the points are the important thing. You can make up a counter strain technique once you know the points. So in going through the points, it's easy to group them into three sections. You've got the ankle, you've got the midfoot, and you've got the forefoot. And we'll start with the ankle. The ankle has 6 points. And if we just have a look down here. So the 6 points are broken up into pairs. We've got a point for plantar flexion and a point for dorsiflexion of the ankle. We've got a point for eversion of the ankle and inversion of the ankle, and you've got one for eversion of the calcaneus and inversion of the calcaneus. So there's your 6 points. Now in terms of where they are, just here next to tib ant, you've got the dorsiflexion tender point, which you can shorten that muscle. If we come around the other side and come right up into the calf up here, we have a tender point in here which will work for plantar flexion of the ankle. We've got a lateral point for eversion of the ankle. We've got a lateral point for eversion of the calcaneus. There is a little trick for that one, but we'll do that in the course. And if we just come around the other side, we've got a point for inversion of the ankle and a point for inversion of the calcaneus, which there is a little trick to that, which we'll do on the course as well. And there's your 6 points for the ankle. Plantar flexion, dorsiflexion, inversion, eversion, and inversion calcaneus, eversion calcaneus. All right, so that brings us to the midfoot. Now the midfoot also has 6 points, and the easiest thing to use as a point of reference is on the midfoot. You've got two big bones. You've got your navicular here, and you've got your cuboid over here. And so the key points of the midfoot is that you have a plantar navicular and you have a dorsal navicular. You have a plantar cuboid and you have a dorsal cuboid. So there's 4, 1, 2, 3, 4. And then on the plantar surface, you've got the insertion of the plantar fascia, which is one of the big problems that we see from time to time with feet. And so you've got the insertion of the plantar fascia, and then going up to the midfoot, you'll also have the insertion of the plantar fascia into the med heads. And the one little random one that we've got here is right in the middle on a bony part of this talus. There is one extra point there, which if we look on the skeleton, it's just this little bony point of the talus, just on that joint there. We can get a tender point on that one in the midfoot too. So there's our 6 points in the midfoot. We've got the navicular and cuboid, 1, 2, and 3, 4. And then for the other two, you've got the plantar fascia where it starts, and you've got this little talus point, which gives us the 6 points of the midfoot. So 6 in the ankle, 6 in the mid, and then you've just got the rest of the foot. So you've got the insertion of the plantar fascia down here, which we've already started with here. And when we're weight bearing, all of the weight goes through this big toe, and so the key points are this met head. There's a couple of points there, and the key points on the other side is actually because of the weight bearing, the way that you heel strike and the weight comes through here. We've got a 5th met point just here, and that's the forefoot. And the only other thing that we've got to look at is the toes, and usually the most important one is just this metatarsal phalangeal joint area, but it is important in some cases to really just check all of those little toe joints and just check that there's nothing standing out there which is stopping the whole foot from getting to a neutral. So we do sometimes have to scan across the toes as well. So there's the points. So if you can just go through those a couple of times and watch this video a couple of times just before the course, it'll just help you have seen it a couple of times before you actually have to do it. And the more times you see it, the easier it is for you to take on the information from the course. So we'll see you there.